My name is Brittany Smith. I'm a nurse practitioner student and I'm going to be doing a head to toe assessment. And here's my government issued ID. And now we're going to scan the room. Okay. And so, hi, I'm Brittany, nurse practitioner. Tell me your name.
Hi, Allegra Holder Clinton.
Okay, great. And if you could just come on this way, we're going to do an exam here. And you're just going to have a seat here. Okay. So if you would just tell me your date of birth and tell me what day it is today.
7/15/1992, and it is February 10, 2019.
You know where you are?
I'm at the clinic.
Okay, great. So prior to coming in before I begin the actual assessment, did obtain a full set of vitals along with height and weight. Also did perform the Snellen chart in which Ms. Holder Clinton wears corrective lenses and scored a 20/30 on the Snellen chart. Okay. So just looking at you as you walked in, I observed your gait. I didn't notice any abnormalities with your walk or with your gait, anything that was unremarkable. Any problems while you're walking or ambulating?
No.
No? Okay, good. So overall, I'm just going to observe the skin, looking at Ms. Holder Clinton, nice brown color. Don't see any changes or two-tone in her skin. And no lesions, no bumps, can't see any visible, just one mole there, no skin tags. As I'm looking at her arms, and it's also going down to her feet, no changes there. Any pain today?
No.
Okay, good. So looking at the head, Ms. Holder Clinton has a normal size head, normal cephalic head. It appears to be in line, midline of her neck. Eyes and ears are lined. Looking at her hair, nice and brown, looks thick and moisturized, doesn't appear to be dry or brittle. And I'm just going to palpate. Any pain?
No.
No? Okay, good. So no lesions or depressions noted here. So what I'm going to do is begin with the eye exam. But before that, just again, looking at your facial structures, I just want to make sure everything is symmetrical. So if you could just smile for me. Good, nice, pretty smile. And if you could make a frowny face. Good. Blow a bubble in your mouth. Okay, and raise your eyebrows. Okay, good. And so with that, I don't see any drooping. Everything looks midline and symmetrical. So what I'm going to do is just look at your eyes. So if you could, you're going to look straight at me, and what I want to do is just check your peripheral vision. So when you see my hands come into your line of vision, you're just going to say, I see. Okay? Here we go.
I see. I see.
Look straight at me.
I see. I see.
Okay, good. So what I'm also going to get you to do is just follow my finger, okay, with your eyes. Okay, good. Look at my finger. Follow my finger with your eyes. Okay, good. Sorry. All right, so also what I'm going to get you to do is I'm going to get you to move your glasses for me. And I just want to actually take a look at your eyes, okay? So if you could look up, okay, just looking at the sclera, they look nice and white. I'm just going to pull down the conjunctiva, which is nice and pink. I don't see any drainage, no tearing at all. Any problems with your eyes or pain?
No.
No? Okay, good. So what I'm going to do is I'm just going to do an eye exam. I just want to take a closer look at your eyes, okay? So I'm going to shine this bright light right in the center of your eyes. You're just going to look at me, okay?
Okay.
So good, looking at the eye, I can see the optic disc, which is nice and orangey red. No hemorrhaging there. Doesn't look like any damage to the eye structure. Same thing here. So just observing, I do see that optic disc, which is nice orange red, no hemorrhaging, no damage to the eye structure. Okay, continue to look at me. Both eyes do dilate and constrict, and they're reactive to light. Okay. So what I'm going to do is I'm also going to continue with the nasal exam. Can you cover one nostril and blow in and out for me? Breathe in and out. Do this. Yep. Any problems breathing in and out?
No.
Okay, good. Just want to take a closer look in the nerves. So just assessing, it looks nice and pink. The septum looks midline. Doesn't appear to be red or any damage to the nares there. Okay. So what I'm going to do is do ear test, a hearing test, hearing test. Okay, so what I want to do is I'm just going to cover one ear, and then you're going to repeat back 3 things that I say. We'll do the same for the other ear, okay?
3, 4, 5. Blue green fish.
Good. Okay, any pain or tenderness to your ears?
No.
Okay, good. Going to be doing the Rhine and Weber test. What I'm going to do is you're going to hear a sound. I'm going to put it right in the middle of your head. You're going to tell me if you hear that sound greater in one ear or the other, or if they're equal in both. Okay? Here we go. Okay, good. What I'm also going to do is going to strike the tuning fork. I'm going to put it on the back of the bone. I want to hear how long you hear it. And then I'm going to put it to your ear. You should be hearing that twice as long, but let's see how you do, okay? Tell me when it stops.
Let's stop. I can hear.
Tell me when it stops. Did you stop hearing it?
It stopped.
Okay. Same thing on this ear here. Oh, let's do that again.
It stopped. It stopped.
Okay, good. Okay. So what I'm going to do is I'm going to get you to close your eyes. What I'm doing is just testing to see what you feel. Okay. So if you feel me touching your face, you're just going to say I feel it. Okay. Close your eyes for me.
I feel it. Feel it. I feel it. I feel it. I feel it. I feel it.
Okay, good. Keep your eyes closed. What I'm going to do is I'm going to wave something in the front of your nose. You tell me what you smell, okay?
Okay. Alcohol.
Okay, good. Okay. So what I'm going to do is feel for the TMJ, okay? So if you could open your mouth for me, move your jaw from left to right. Good. Any pain there?
No.
Nope. Stick out your tongue for me. Move it side to side.
Ah.
Okay, good. Okay. Just going to be feeling here. So I just want to take a closer look inside your mouth. Stick out your tongue for me. Lift up your tongue for me. Soft palate, hard palate look good. Tonsils, I can see. They don't appear to be swollen. Are you sick today at all?
No.
No? Okay, good. I just want to feel for your lymph nodes as well as, in your sinuses, okay?
Okay.
Any pain at all?
No.
And I don't feel any small or hard nodules that would indicate any infection at all. Nothing? Okay. I also want to just feel for the carotid artery. Okay. And then I'm just going to observe for the trachea. If you could lift up your head for me. Okay. What I'm going to get you to do is I'm going to pour you a little bit of water. You're going to swallow when I tell you. I'm just going to feel here to see if I can palpate the thyroid, okay? There you go. You're welcome. Don't swallow yet. Okay, go ahead and swallow for me. Okay, good. Thyroid is non-palpable, but the trachea is midline, non-movable. Okay, so what we want to continue to do is if you could shrug your shoulders for me, release. Good. Any pain with that?
No.
No? Okay, good. You want to press down, try to lift your shoulders up? Good, nice and strong. Continue to still observe the skin, making sure there's no changes here. Checking for capillary refill, which is less than 2 seconds. If you could squeeze my fingers. Good, nice and strong. Press against my hands for me. Good, good, good. All right. Any pain to your shoulder or elbows?
No.
Okay. Good. All right. So what I would do if I were doing the breast exam, then I would be looking for any skin changes or dimpling. I would also be measuring using the 4 quadrants in the tail, palpating, starting at the areola, moving my way out in a circular motion, palpating for any masses. So what I'm going to continue to do is go on with the cardiovascular and respiratory system. Looking at the aortic. Pulmonic. Excuse me. Mitral. Okay. If you could take a deep breath in and breathe out. Lift your arm for me just a little. Breathe in and out. And the same thing here. Breathe in and out. Okay, good. I'm also going to be doing this assessment to the back. I'll also be observing the skin here, making sure I don't see any lesions or bumps. Skin is smooth and clear. Okay, what I'm going to do is percuss here. Any pain?
No.
No?
No.
Okay. What I'm going to get you to do is I'm going to listen, and you're just going to say this phrase 99 for me every time you feel me touch it, okay? Here we go.
99, 99, 99, 99, 99, 99.
Okay. And I'm also just going to be listening to your breath sounds again, okay? So take a deep breath in and breathe out for me. I want to tell you. Here we go. Good. Okay. Any back problems at all?
No.
Okay. So I'm just going to be feeling down the spine. And no pain here, right?
No.
Okay, good. So now what I'm going to get you to do is you can put back on your glasses. Sorry
Thank
about
you.
that. You're welcome. I'm going to get you to just lay down for me. Just going to continue the assessment.
Okay.
Okay? All right. So what I'm going to be doing is just doing an abdominal exam, okay? So I'm just going to be observing the skin here. Still seems to be same color, no skin variations here. Any pain to your abdomen? No? Okay, good. So I'm just going to, I'm just going to begin to lightly palpate here. Any pain?
No.
No? Any tenderness?
No.
No? Okay. Okay, and I'm also going to do a deep palpation here. Any pain with that?
No.
Okay. Just want to take a listen. And then I'm also going to be listening for bowel sounds. Good. What was your last bowel movement? Or any issues having bowel movement at all?
No, my last one was today.
Okay. What about any problems urinating at all?
No.
No. Any children?
Yes.
Okay.
I'm on my period now.
Period. When did it? What's the first day of your menstrual?
2 days ago.
2 days ago? Okay. And you did have a cholecystectomy, right?
Yes.
So McBrain's point will not be able to be assessed in this client here, okay?
Okay.
Any pain in your legs at all?
No.
No? What about the back of your legs here?
No.
Nothing? Okay. I'm just going to feel for pedal pulses here.
Okay.
And still continue to do a deeper assessment of the skin and the feet. Okay. What I'm going to get you to do is just lift this leg up for me and then drop it. Good. What about this one here? Any pain while you're doing that?
No.
Press against my hands. Do the back of your legs hurt when you're doing that?
No.
No? Okay, good. Also feeling for any edema. There is none present here. Even up to the legs here. No? Okay, good. I'm going to go ahead and get you to sit up for me. Okay, good. And then lastly, what I want you to do is just stand up for me. Okay? And just to test the balance, can you stand on one foot for me? What about the other foot? Good. Any pain? Feel okay?
No, I feel fine.
Feel fine? Okay, thank you so much for your time today.
Thank you so much.
You're welcome.
Have a good day.
You too. Bye-bye.
Bye.